Carolina Health Informatics Program at the University of North Carolina, Chapel Hill trains students in the field of biomedical and health informatics. They have a very diverse pool of students ranging from high school to PhD. In order to bring the Visible Human project data to such a diverse audience, CHIP worked with Building 25 to design an innovative and educational VR environment. In this VR experience, students can explore the data from the Visible Human Project, or VHP. The VHP is a library of cross-sectional cryosection, CT, and MRI images obtained from one male cadaver and one female cadaver. The datasets were designed to serve as 1. A reference for the study of human anatomy, 2. Public domain data for testing medical imaging algorithms, and 3. A testbed and model for the construction of network-accessible image libraries. We used these datasets to create a 2D slice explorer and a 3D volumetric rendering of the head subset. Because not all students have experience with VR, the prototype onboards new students to the controls and conventions. First, students are oriented to the VR environments, getting used to looking around in the space. Next, they're introduced to using the Oculus controller swipe gestures. This familiar touch-based control allows users to move through pages of information or change zoom and rotation for images and 3D models. Finally, users learn to use the wrist twist and tilt controls. These provide similar navigation to the swipe gestures but allow for greater fidelity. From the home screen, students can study anatomy models, the 2D slice library, or the Visible Human data set. In the anatomy section, students can explore 3D models of anatomy from the head, thorax, or leg regions. The use of animation helps demonstrate the complexities of a beating heart or how eye muscles help our vision. The exploded view of muscular structures in the leg helps illustrate the complex structure and relationships of this system. Students can use the swipe and twist controls to get up close and personal while orienting the models for a better view. The Slice library provides students with the ability to navigate through a subset of images of the male head. Students can browse the pages of 2D images and zoom into individual images for a close-up view. The Visible Human dataset allows students to visualize the data as a 3-dimensional model. We utilize the anatomical male sections from the National Library of Medicine's Visible Human project to generate a 3D volume of the male subject. The ability to explore this model in a VR environment helps with understanding spatial relationships. Our solution runs on Oculus Go headsets, which are affordable and portable. Compared to an expensive VR lab with tethered headsets, it feels simple and elegant. Despite this simplicity, the developers had to overcome significant technical challenges. Real-time volume rendering is computationally expensive, especially at higher levels of fidelity. At the same time, mobile VR headsets have limited CPU and GPU performance. We are very proud to have delivered a lag-free experience on a mobile VR headset. Based on the user research and testing done by both teams, we learned that students were excited by the use of a VR solution to support the study of health informatics and complex datasets. VR tools are visual and physical by their very nature, and this appeals to students. They articulated the need to see and manipulate datasets directly, as well in a physical manner that helps them stay alert, active, and focused. Students said that study aids like our prototype could inspire them to learn more about the field of health informatics, digital health, and CHIP. To find out more about CHIP and all their exciting programs, please visit chip.unc.edu/programs.